Hello, I'm Dr. Peter Chu. Welcome to this episode of the Fertility Diet. Well, I have 7 grandchildren from 2 married children. I suppose they have observed how I interact in my younger days. You know, my wife and I came from a relatively big family. So they must have observed us interacting with our cousins and our siblings when they were young. This might have influenced their mindsets when they get married. There's an old saying that you are what you eat. And according to the US studies, that if you have a good nutritional status before conceptions, a healthy parents will have a healthy pregnancy. And a healthy pregnancy means the baby is healthy and the offspring and the subsequent offspring will be in the better position, will have a head start. And therefore, fertility is related to diets. And according to the US studies, there are 5 things that you can do. One is whole grains. You know, you eat a lot of whole grains, such as wholemeal bread, oats, oats meal. Then you have good oils. Usually they are plant-based, such as olive oil, sunflower oil, corn oil, and soybean oil. Okay. And the third item is vegetables. You know, a lot of Singaporeans don't like to take vegetables. This is an acquired taste, such as tomatoes, asparagus. All these are very good for fertility. Then the fourth item is fruits. You know, plenty of fruits in Singapore. We are very fortunate. You can have all kinds of fruits, such as oranges, apples, berries, bananas, papaya, and so on. Then the last item, which is very important, is fish. In other words, the proteins, you know, salmon, codfish, and small fish like garoupa, ikan bilis, all these are very nutritious. So all these 5 items will help people to conceive much faster than those who don't take these sort of diets. So in general, food are divided into macronutrients and micronutrients. Macronutrients means carbohydrates, fats, and proteins. Micronutrient means vitamins, trace elements, antioxidants, and so on. So let's look at the macronutrients, the carbohydrates. So what should be people who are trying to conceive, what should they eat? Instead of simple sugar, you should take complex sugar or complex carbohydrate, such as wholemeal bread or oats. These have a very low glycemic index, meaning that when they get absorbed slowly into the system, by the digestive system, and therefore the blood sugar doesn't spike so fast. So as a result, the insulin will go up slowly. You know, our insulin is produced by the pancreas to lower your blood sugar, to maintain your blood sugar normal. So if the insulin is too fast, the blood sugar will go down too fast, and that will make the person more hungry. He will feel he has to eat more in order to maintain it. And this is happening if you take simple sugar, such as refined rice, that means white rice instead of brown rice. So that is why people who eat simple sugar tend to feel more hungry, and therefore they tend to put on more weight. And you know, weight is very important as far as fertility goes. Now, the BMI, which is an index of measuring the size, the body size. In Asian, it varies from 18 to 25. If you are too overweight or obese or underweight, you have problems with your sperm and with your ovulations. So you should have an optimal body weight. And body weight comes from what you eat. And as far as the fat is concerned, instead of, trans fats or those lousy fats. Trans fat means, you know, those cookies, French fries, those sugary stuff, fast food, all these have a lot of these lousy fats. So you should choose healthy fats. And healthy fats means, you know, those with monosaccharides, like what I've told you earlier on. It is the plant-based oil as well as fish oil. So fish oil means omega-3. The plant-based oil are usually omega-6. Okay, but they are all good oil. Okay, so as far as the protein is concerned, try to take more fish rather than red meat. Now, red meat give the body a more inflammatory response, and a lot of our body conditions, for example, endometriosis is a chronic inflammatory disease. So if you take too much of this red meat, of course, in moderation is okay, but if you take too much, like burgers, like processed food, all these things, it will impact your fertility. Now, as far as vitamin is concerned, a lot of vitamins are good for egg health as well as the sperm health. So all the vitamin A, B, C, D, E, all these are good for the sperm and the eggs. And you can get it from the vegetables and a lot of fruits. And the trace elements, actually nuts and seeds, have a lot of trace elements like magnesium, zinc, selenium. All these are important for the sperm as well as the egg. Antioxidants like CoQ10 and all the trace elements, the fruits, they have a lot of antioxidants as well. Now, dark chocolate also has a lot of antioxidants. The good drinks, I usually tell my patient, is water. Actually, water is important. If you drink plenty of water, it helps the mucus productions in your cervix. And if you are well hydrated, the cervical mucus, you know, during the ovulation, the cervix will produce a very transparent egg white mucus. And according to the Harvard studies, if you drink plenty of water and hydrate yourself, your mucus will be better than those who seldom drink enough water. Now, sugary drinks or juice, you know, you go and juice all the fruits, you are actually taking sugary drinks. And that is no good because too much sugar, simple sugar, your blood sugar goes up, you feel more hungry, you tend to put on more weight, and it doesn't serve very much purpose. It just give you empty calories. Okay, so I think as far as drink is concerned, try the good old water. I think that's the best. Okay, now coffee in moderation. Alcohol, social drinking, that's okay. But if you are drinking alcohol almost every day, you know, beer, whether it's a beer or other alcoholic drinks, it will definitely affect your eggs production as well as the sperm production. People have done studies in this PCOS, which is polycystic ovarian syndrome. That means this is one of the common infertility problems, no ovulation problem. They have the eggs but cannot ovulate. The growth is no good. There's a lot of high androgens inside. So for PCOS, the things to avoid are like what we said, and the inflammatory food, those processed food, and so on. But in PCOS, what you should do is you should have regulate control of your insulin. So therefore, a Mediterranean diet actually may be useful. And you have to reduce your body weight because all the hormones are stored in the fat, and that indirectly affects the ovulation. All right. Now, Mediterranean food essentially composed of plenty of vegetables, plenty of fish, and plenty of good oil like olive oil, and limited amount of white meat. So what is white meat? White meats are usually from poultry, like chickens, whereas beef, lamb, or even pork is considered as red meat. because they have a lot of this iron content in the muscle, so they appear red. And the chickens and the poultry's meats from the poultries are considered as white meat. So you should eat less red meat and more white meat. For uterine fibroids, there's contradictory, studies. Some says yes, some say no. Some people talk about green tea as an antioxidant. Green tea by itself is quite okay. But if you take it in moderation, that's fine. But you don't have to be addicted because it contains caffeine. What about coffee? Coffee is also contains caffeine, more than the tea. But if in moderation, it shouldn't affect fertility so much. Now, for endometriosis, intervention studies have shown that mainly is reducing the symptoms and not the cause. So diet doesn't influence so much the disease process, because the disease process can go on, but the symptoms can be less if you choose Mediterranean diet or DASH diet, those low salt diet. Well, as I said, if you take plenty of vegetables, fish, nuts, and seeds, and good oil, I think that will help you to have a healthy body. But if you have PCOS or other ovulatory problem, then you should have it checked and treat it accordingly, and not just only by diet. That will help you to make your BMI good, but you still have to treat the source, the cause of the ovulatory problem. You see, the low sperm count account for about 30 to 40% of fertility, and some of them are born with it. That one, nothing can help. Okay, some of them are born with the varicose, that means the varicose veins. That one also, you're born with it, you have to treat it. But as far as diet is concerned, you have to maintain a good BMI, not to be too obese. And also, if you have a family history of high blood pressure or diabetes, you should cut down salt and sugar. And if your sperm count is low, you should take quite a lot of nuts. The nuts has a lot of trace elements and antioxidants, and that will help. Okay, and like what I've said before, if you take a lot of fish, a lot of vegetables, a lot of fruits, I think that will also help the low sperm count. A good dietary habits will definitely help even when we are doing assisted reproductive technology such as IUI or IVF. So the success rate will increase if you have a good dietary habits. So some people sometimes don't have fixed meal. I think this is also not a good idea. You should have proper meals and don't skip meals. You see? So have a fixed meal plan every day, and you can calculate your calorie intake so that you don't overeat or you don't starve. Okay, besides those good choices of food. Okay, talking about miscarriage. Now, there are a few types of miscarriages. 70 to 80% is due to genetic problems. And genetic problems, no amount of medicines or diet can help. Okay, whereas the 20 to 30% sometimes is due to some other causes, and one of them can be reduced by getting a good diet. For example, if you want to conceive, folic acid is very important. It's one of the vitamin B vitamins. Folic acid is very important because it reduces the abnormal formations of the nerve systems. And therefore, if you want to try for baby, you should take it 3 months before you try for the conceptions. And during pregnancy, you should continue with it. Okay? And folic acid is one way that you can help to reduce the miscarriage. So what are the food to avoid when you are pregnant? Okay? If you have a history of diabetes, family history of diabetes, or you are already a diabetic, then you have to cut down sugar, especially in the first trimester. Okay? If you have a family history of high blood pressure, then you should cut down salt. And a lot of these things can come from the hawker's food fare. So when you go for the hawker's food, sometimes no choice but to get the takeaway from the hawkers, then you ask them, cut down salt, cut down oil. Okay? Now, as far as milk is concerned, or dairy product is concerned, cut down, don't take unpasteurized food. All right. Now, in the preparation of food, if you get bacterial contaminations like salmonella and other bacteria, you get food poisoning, you can also lead to miscarriages. Okay. So therefore, if you want to take things like sushi, make sure it is properly prepared and it must be clean and fresh. If you are trying to conceive, don't wait, because age is a very important factor. You know, for the females, they emphasize about the biological clock for the females. You have a finite number of eggs, and with age, it just goes down, and the miscarriage rates also increase. But I have to emphasize that for the men, there's also a biological clock. As you get older, the sperm counts also go down. Now with pollutions all over the world, the average sperm count from country to countries, the industrial countries, the number has gone down over the years as well. So don't wait if you are trying for a baby. Age is very important. All right. Now, besides age, I think a balanced diet in moderations, as I said earlier, and then exercise regularly, not once a week, that sort of things. You must maintain about 3-4 times a week, each time about half an hour. That will maintain a good body weight as well as health. Okay, and sleep is also very important. You don't have late nights, because sleep deprivation also can affect your menstruations, irregular menstruations. So a lot of Singaporeans like to have late nights and get up early to work or get up late. So that's disrupting the whole system, the circadian rhythm in our brain. So I would like to advise those people to look out for all these things besides diets. So you should also have good lifestyle. All right. So besides exercise, I think you should stop smoking if you are trying to have babies, and alcohol only in moderations. All right. And make sure that you eat well, sleep well, improve your immunity. Now with COVID, you have to reduce your stress. All right. And get vaccinated early, such as even COVID. If you are trying for a baby, you can have COVID vaccinations and German measles vaccinations, hepatitis B vaccination, and so on. Thank you for joining me today. I'm Dr. Peter Chiu.